talking about the tools. At 7:30, if we're all still on this webinar, which I think we probably will be, we'll be having a noise making session to make noise and celebrate and honor all the healthcare providers who are working so hard on the front lines. So you can grab a noise maker if you have one. We'll unmute the lines for that.
I'm using my metal measuring cups. They make a great noise.
Yes.
What's your choice? This or this?
Oh, maracas.
Oh, maracas.
Okay,
Yeah.
maracas. These are what we went to Cuba many years ago. Here you go. That looks like another world. Going on vacation somewhere looks like another planet altogether, doesn't it? Okay, should we get going? Are we good?
Yep.
Perfect. Let's get going then.
Okay. So I already had this slide up, Doris, about these webinars. So this is webinar number 2, and we'll be having another one next week. So, and this is the webinar team.
So
and
every Monday, right?
Yes.
Same time, same place, same coffee mug, different fresh coffee. Very good, very good. So that's the hashtag for you when you, for example, now can take pictures. Oh, I see Natalie. Natalia, hi. That's our MPP, Natalia Cosandova, who, by the way, was a member of our assembly. Can we see her? Natalia, can we? Kerry, can we unmute Natalia so I can take a picture? And we can tweet her. How do we do that?
Hi, Natalia. I just promoted you to a panelist role, so you should have access to a camera if you'd like to.
Say hi.
Hello. Hi, everyone. Can you see me?
We
No.
can. Yes, we can.
Yes.
Okay.
Good to see you all. Good to see you. Hello.
Okay, good. Where are you, Natalia?
So I'm actually in Pickering with my assistant, Paula. You've met her.
Hi,
So we're
Paula.
working. Yes, she's here, and we're working hard from home. Today we delivered some PPE to Ontario Shores because they ran out of gloves and they were low on masks. So we were able to get some from donors, and we delivered it today. And so we continue to just try to fill those temporary gaps as we await those big shipments that we keep on hearing about from the Prime Minister.
Very good. And Natalia, just so you know, guys, she works also as a nurse in the emergency room in the hospital 3 days a week. So kudos to you, Natalia. And more importantly, she even tweets and retweets the complaints I have about PPEs.
Yes, that's right.
So
yes, Doris,
the latest and good news is that as we speak, 5 minutes ago, I was invited to a Health Canada meeting. We will see what they have to say to me about this issue on PPEs.
Amazing. Keep us updated because you probably have more info than I. So keep us all updated. We're all dying
totally
to know when it's coming. Yeah.
I so totally do, Natalia, that my report that goes to members and to 200,000 people every day is now going to become an open blog.
Yeah, so me and Paula, we read it every night. You're a night owl just like us, so you usually send it around 1 in the morning, and that's when me and Paula read your reports and highlight anything that's important. Yeah. Excellent. So thank you for sending those. You know, it's very helpful even for us to know what's going on.
Very good. Okay, guys, let's keep going. So that's the Together We Can Do It, and we want everybody to get on whatever tool, whatever lights, whatever smiles, whatever claps at 7:30 every day. And I keep saying, at times it will be to celebrate and say thanks, and at times it will be to suffocate pain and upsettiness. It will be a mix of feelings, and we are all entitled to those feelings, and no one should feel guilty about those feelings. We are all in this together, and together we can do it. So we will keep going together. Next one, please, Susan. So from the get-go, we have been pushing to prepare for worst case scenario. We do not believe, well, we know, not that we do not believe, we know that was not the case at the outset of this when it was still an epidemic. And I'm afraid to say that to this day, I don't feel that we as a province are preparing for worst case scenario. And I'm not talking just rhetoric. I'm talking from the report that Matt Anderson and Steiny Brown and Peter Donnelly and then the Premier spoke about in relationship to the preparedness and where we are as a system. Basically, if you look at the lines of that report, and next time we will put that on the screen, it shows clearly that we are preparing for best case scenario, and we are not, nor we will ever be a best case scenario. In our view of RNAO, we must prepare for a worst case scenario so that we are not caught by surprise, and that if we prepare for a worst case scenario, which really mean shutting down the city, which really mean people not just keeping social distance or physical distance, but staying home, but absolutely staying home unless they are essential workers. That really means testing much, much more than what we are doing. Our level of testing the population is nil comparing to what needs to be. If we do a lot more of that, then we will end up in our view, in the middle of the pack, and that will be good news. If we don't do that, we will overwhelm the system completely by lack of testing, meaning that the virus will continue to spread at the community at higher and higher rates. It will soon start to spread not only in nursing homes, which already is an issue. We have about 80 nursing homes in an outbreak, 80 nursing homes and retirement homes. We are starting to see signs of fire in some of the shelters if we don't move quickly to open the sites for people that are COVID positive so they can be properly isolated, attended to, and if need be, those that will need a respirator that can be ventilated right there on the site. If we don't move, and RNAO is very, very heavily involved with that, with Dr. Andrew Bond and with Lee, our own Lee Chapman, that will be the clinical director. We have 100 RNs ready to go from via nurse to serve those persons that experience homelessness in the special sites, but we are still entangled in some legalities that are absolutely essential to deliver in order to protect, quite frankly, the health professionals that go there. So the Health Promotion and Protection Act needs to be as part of the Memorandum of Understanding in order for us to be able to have the infection control practices, the PPE, etc., that is essential for the colleagues that will be working in those very, very compromised settings. My fear is that if we don't move soon, we will start to see rampant outbreaks in shelters, the same as we are seeing in nursing homes, and of course the same will happen in correctional facilities. That's a grim picture, but I am never one to give glossy pictures or a lot of flowers. I think flowers are for funerals, and I want less flowers and less funerals and more action. And the same goes for PPE. To me, it is very disheartening. A minister that I respect greatly, that on Thursday she was still saying in the microphone to the media, we are okay with PPEs, we are not rationing. It is disheartening because RNAO is the one that is getting the hundreds of emails, some of which I send directly to our office to deliver PPE in nursing homes, etc. We have been short of PPEs from the get-go, and now the Premier said we have 1 week left. So the situation is dire, and we will see how it gets resolved. The media just asked me today, and you will see it, and you will see it again on Wednesday. I'm on the agenda about the duty to care. My answer is the duty to care needs to be matched with the duty to protect. And yes, we sign on the line, all of us, about the duty to care when we go to work. Also, employers and governments need to sign on the duty to protect. And in this case, I say governments because employers are doing heroic efforts, including the reprocessing of N95 masks, which we will talk more later on about all that. Next one, please, Susan. So again, we will keep talking about worst case scenario with the hope that we will never get to that scenario. But if we don't prepare to worst case scenario in terms of PPE and in terms also of ventilators, we will find ourselves there as it happened in the US, which is a horrifying tale when you think that it's a country, this is not a poor country, this is a country of humongous resources and capital, and yet they're in a dire, dire situation. And as for President Trump, his solution of closing the borders and not allowing 3M to deliver to RNAO is unfathomable, narcissistic, egoistic, and I am not going to use more adjectives because it will be akin as us saying we will not send the thousands of nurses in Windsor to work to the major hospitals in Detroit to serve the patients. And if someone asks me if we should do that, I will say no, because patients shouldn't pay the price, nor should be health professionals. But that's what's happening with that type of unmatchable, because nobody else in the world will even think to do what he's doing. But the fault is not only on Mr. Trump. We here at home have a lot to do and very few days left to deliver on the duty to protect health professionals. In relationship to honest and transparent communication, that's about the only thing you will get from RNAO. Honest and transparent communication, we committed to that from the beginning of this ordeal. We will do that till the last minute of it and thereafter. And I'm pleased that the Premier is starting to put as much as possible its transparency out. And I say as much as possible because I'm yet to hear about ventilators and how many of the up to 10,000 have been ordered, what's the delivery times, because ventilators are essential to save lives in relationship to COVID-19 patients. Universal PPE in all sectors, we have been asking for quite some time. We are talking about these surgical masks, basically 2 per person at the beginning of the shift in every single sector, including nursing homes before an outbreak, and not what's happening now that is after an outbreak. It is absolutely essential if we are to save lives of residents in long-term care. And it is essential because most of those residents, even if we had ventilators, will not make it. So protecting outbreaks is really protecting life of residents in nursing homes. And just picture, we said to all of their families and friends and loved ones, stay out because we will close the home so that we can protect residents. But really, we are not fully protecting residents unless the workers that come from outside can have the PPE to protect actually the residents from what we are bringing from outside. And those families have a right to see their loved ones after this nightmare is over. So we will continue to insist on behalf of the families and the residents and our colleagues working in the nursing home sector for PPE there, and the same for shelters and the same for correctional facilities. We have asked for a much more serious shutdown movement on the streets. I hear through your emails that I receive every day after the report is gone. The next day I'm full of emails of people at shoppers in the lineup not keeping the 2-meter distance, people have at the bank tally not, people in the supermarket not, etc., etc., etc. I also hear, not a lot, but I do, and I wrote about that in my report last night, of staff. I'm not saying those are nurses, PSWs, or doctors, because I don't know who they are, but staff going with their trousers and their uniform and their shoes from work to public places, and that, of course, in good times is horrifying. In bad times, is simply unprofessional, unethical, and against any infection control advice. But shutting down also means more on the issue of construction workers. I can tell you that right next to my house, there is a beautiful house that is being built. I know the owner of that house. Nothing will happen to him if he were to wait a few more months. And the reality is that those workers, as much as the premier wants them to work with 2 meters physical distance, is impossible, nor is possible for many of them to have the water facilities to wash hands, etc. So in the view of RNAO, the province has not gone all the way in what really means to shut down. And if we don't shut down, if we don't shut down and we don't test sufficiently and we don't have PPE, all we are doing is extending the period of time that we will have this situation upon us, and which means also impacts the economy. So it's not as if the economy will be better because we are taking less action. Actually, the economy will suffer just for a longer period of time. Telehealth, you have read my reports from a long time ago. We started with virtual via nurse at the request of telehealth. And I can tell you that they have taken likely about 50 nurses, that's all. I still hear the lineups and the wait times are tremendously long in hours, so I'm not sure why we have not taken more nurses to telehealth, or why we haven't used several platforms, which is what we proposed at the beginning, to respond in a faster time to the public. Take care of health workers and physical mental health. We have created several resources. Heather, maybe I can ask you a bit about the long-term care resources for support and the one that Irma Jean and you are involved, please.
Sure, I can talk about that. So we've developed a number of resources based on questions and feedback that we've received from this venue and also our team with the nurse practitioners that work in long-term care. So we've developed some resources, a protocol for isolation in long-term care, palliative care at end of life in a pandemic, which one of our nurse practitioners just reviewed since we've been on the phone in about 15 minutes, and she's provided me with some feedback which I've incorporated, so that's ready to go. Been endorsed by Advantage Ontario, and also a tool really reflecting a number of resources that are available for mental health and well-being supports. And that's not specific to long-term care, but rather really looking at provincial, national, and international resources that are available to support the public and healthcare providers with mental health issues during this very stressful time. We've also been able to establish a number of Facebook groups, and we went with Facebook because that was the most expedient approach that we could do to have a respond quickly. And so we've got well over 100 family members that are participating in a Facebook group that is focusing on supports for families with loved ones in long-term care. And we've been able to help moderate that through the expertise of 3 of the members of our long-term care best practices program. And they're on a daily basis responding to questions, supports, providing information to family members that have loved ones in long-term care. And the majority of the questions they have are about, virtual visiting, how do I stay connected, but also, really trying to understand what's happening in terms of some of the changes that they're hearing about from the long-term care home itself. We've also been able to launch, with the support of our policy department, our long-term care best practices program, and our international affairs and best practice guidelines team, 2 new Facebook groups. One is focusing on peer-to-peer support, and the other one is really looking at emerging issues. And so Susan and Irma Jean have taken a major lead at getting that organized. We've had a number of our staff members, many of them, just stepped right up and said, let me help, I want to moderate. So those are ready to go now that we've got our moderators all trained and organized. So those are ready to go, and we should be releasing those this week. So these are, again, all just supports that we're looking to provide to support not only practitioners in their own struggles with this work and their opportunities for sharing great ideas and strategies that they've utilized to help be safe and support the individuals that they're caring for, families and communities. So thank you for the ideas, and we're delighted that we've been able to respond so quickly.
Beautiful. I just got a video. Can you guys see? I will send it. We just got a video done by WHO where we are profiled, by the way, and it's in relationship to World Health Day, which I shouldn't forget is tomorrow.
Yeah.
And you already have it in the loop. You all got in the loop today. The link for the Facebook chat tomorrow, which is World Health Day, is there. At RNAO, we created a beautiful logo that will go below our signature. I suggest, Kyle, that you give that logo, ask Marian, and send it to everybody. And if you guys want to put your logo, Natalia, others, put it tomorrow, the whole day and the day after, and maybe the whole week we can do. It will be beautiful. It's about nursing. It says Year of the Nurse, and then it says knowledge, compassion, and courage, and below that says COVID-19, and it's just beautiful. So we can share that, and we can share the video also. It will go in my report tonight, and it will be sent tomorrow with a press release. Tomorrow also, just so you know, the report, state of nursing will be released, and we will be sending it to you also. And we will be sending also, as I said, the press release. So that's in relationship to something energizing, in addition to the support systems that Heather just mentioned that are very positive. Very much like nurses in the front lines, I need to say. A reporter was just asking me, how am I? And I said, likely like my colleagues in the front lines, a mix of feelings. From moment to moment, desperate and very upset, quite frankly, at fighting for things that we shouldn't be fighting, like PPE, and at moments inspired, like the story I read last night. But when I finish the report every night, I do two things. One is I look at all day together we can do it, because I plug them, right? I plug the peak of the day into the piece, and it puts me so energized and so inspired that really is a good way to finish the day. And yesterday also was the story of Moira Walsh that I did share with you in the report, that was about one of the nursing homes and the amazing, amazing, amazing work that they're doing. Like if every nursing home could do that work, I think we will be in a different situation. But the key was that home had the PPE necessary. That was the key tool, right? A nurse wrote to me the other day, and it stuck to me to this day because it's so reflective of what I think I would feel if I was in the front lines. She said to me, you know, Doris, pre-COVID-19, I used to go to work. I used to be with very complex and very difficult situations with patients, but I could apply all my intellect and all my heart to be with that patient and to do with that patient what I needed to do. Today, I happen to be more worried about PPE and distracted by the PPE than actually being able to take care of my patient. And I went to sleep with that, and it has stuck to me because I so can relate to that, right? So that's why we are behind you guys, trying to push and fight for what's rightful, so you can once again really just be and care with the intellect, the heart, and the hands for those patients that need you desperately and their families. The other issue that we have been pushing for is the issue of ICU beds, which If I put to you in proportion, the UK is building an entire hospital of 2,000 ICU beds extra, right? We are building units. We are building, you know, the cafeteria of a place. We need to think again, worst case scenario, and build way, way more. And for that, of course, you need at least half of those ICU beds to be with ventilators, and you also need the staff. To tell you the truth, and in Italy, the biggest problem was that they didn't have staff. To tell you the truth, to me, the staff is the least of my concerns, because at RNAO with VIA nurse, we have already 900 ICU nurses in reserve, prepared to go to ICUs. So what we need here is the beds, is the ventilators, and is the PPE. That's what we need. And then things will look better, at least in the ICU space. We have said to colleagues, and I went as far, we have said to colleagues, take the nurses now, don't wait for the crunch. And today I went a step further. In our MIOC meeting with government, I said, if I don't see that within a week or 10 days, hospitals are taking these ICU nurses, I'm going to give them to another province, because actually other provinces don't have VIA nurse and they're asking. And I don't want at the end of the day for RNAO to say, oh, we had 900 nurses and 100 were utilized, and then other provinces are struggling. So if you are working with the hospital, or if you are connected with the hospital, tell them now is the time to take, whether it's general nurses or medical surgical nurses or whatever, or rehab nurses, which we have 6,000 of them, and ICU nurses, which we have 900, and also nurse practitioners 250, and PSWs, all the nursing students that's from years 2 and 3 and 4, they can have PSWs. The reality is only 14 hospitals have access staff for VIA nurse. Many, over 100 nursing homes and retirements of have. But hospitals not enough, and they need to do that soon. And if they don't need, we need to know, so we can tell these colleagues that they can go to other jurisdictions where they are desperately needed. Critical care of non-COVID-19 patients, that's also very important, so that they are, you know, separated from the COVID positive patients, and that's happening. Decanting, it's happening already, that we're decanting. In fact, our president-elect Morgan was speaking. I don't know, is Morgan, are you online? I don't know if Morgan is online. Will be great if she can share. We can ask her next time if not. But Morgan was already opening 2 units for patients from LHSC that moved to her, some COVID positive, some not. And then that free up the ICU space in the hospital, and they're at this point at 78% capacity or something like that. The way I see it, and I understand more ventilators are coming, but I don't know, I have asked the numbers, how many and when. If it's not a lot, what we have, in my estimate, will last till mid-May, more or less, and then we will be full still. Prioritize vulnerable populations, critical. So long-term care is one of them, but also there is shelters, as I mentioned already, and I spoke about that, and there is correctional facilities, massive public education, and the public education, in our view, should focus on one thing and only: stay home, period. And many of the premiers and medical officers of health in other jurisdictions, actually, if you take VC, it's the perfect example for me. Both Dr. Henry and the Minister of Health basically say, stay home, no questions. Even the Prime Minister said, stay home, unless you really need to go out, because you must, if not, stay home. Because people are not getting it. People are not getting it. There are still parks full of people. A reporter actually said to me about one, and then we reported that in Mississauga. There is still lineups, there is still shopping, there is still quite a bit of life as usual. And the younger generation sometimes thinks that this doesn't affect them. The reality is, if you look at actually who contracts the virus, very much so younger people also. And if you look at some of the fatalities, actually there have been quite a bit in the younger population. So I'm not sure from where they get the idea that of immortality. But the reality is, even best case scenario, when nothing is happening with them, they have families, they have friends, they are grandparents, and they are members of our community. So the message needs to be stay home, stay home, stay home. I cannot see the last point there, Susan. On the side, solidarity probably, if I remember,
yes, it is.
because I wrote
Yes.
about that. Yeah.
Uh-huh.
So this is the time, and I think RNAO has been remarkable on this, on being together. And I can tell you that the reality from an RNAO perspective between SARS and now is night and day, night and day. I said to another reporter today that RNAO has become the central station, and I really feel that way. Central station in a good way, for nurses for sure, but that goes without saying. But also for other professionals. You have seen joint statements with the OMA on PPE. You have seen joint statements with the OMA and the pharmacists that we did on one of the medications that has not been tested, that is given for arthritis with an antibiotic, and that we started to run out of it because Mr. Trump spoke about it. Yes, there are trials now on that, but one needs to be careful that we are damaging other people, right, that need that medication now too. The same one of the NPs in the previous forum, rightfully so, asked us to repeat and repeat and repeat that if your patients need medications, or you need medications, your family members need medications, for sure, but don't stock for a month, because other people will stay without, because there is already a shortage of medications. So solidarity means to remember that the lady in the street lives alone, to check from time to time how she is doing. Can we bring her the milk or the bread and leave outside of the door and tell her how to put it in after? It means to be kind to one another. It means to be working together, and we are government, federal, provincial, is working beautifully, not scoring points. I mean, if you look the shenanigan in the US of how the president is trying to blame the governor in New Jersey, in New York, those type of things never have happened here, and I tip my hat because really impeccable. And the same between the government and us as an association. They listen, they act many of the things that we are asking. The issue of the PPE, they have not, and we are pushing. We are pushing because we are still convinced that there is PPE available, maybe not through the regular vendors that the government buys, but this is not regular times, and therefore they need to open the box mind and think much, much more outside of the box, because until the province and the country will be able to produce at scale the PPE and the ventilators that we need to absolutely open the venues to any importer that can bring things that are better than nothing. I'm not even saying 3M anymore, because I don't think 3M will be much of an option. But we need to augment with whatever that is the parallel to 3M that is better than nothing, because otherwise, as I say, duty to care needs to be matched with duty to protect.
Actually, Doris, someone just left a note in the chat room that 3M was now going to send masks to Canada. I don't know if you want to talk about that or just highlight.
All I know is that the premier. All I know is that the premier said that he's expecting a shipping of. They asked for 2 million. They're getting 500. 500 takes us only for a week. I don't know about this meeting that I was asked to attend from Health Canada. I'm sure I will hear more. The good news is that I'm one of the first addresses where they tell what's going on because they want me to stop speaking probably about what's going on, and they want me to change the channel to a good channel. And trust me, I would love, more than anything, I would love to be able to say, PP is not an issue anymore, ventilators are not an issue, let's now get to work and save lives and protect our people as much as we can until the end is over. Because that will be a relief for everybody. That will be, this is the only piece. That and massive testing are the things that really keep me up at night and in the phone with other people of like-minded experts. So in terms of masking, for all those facing patients, we spoke in any setting. Urgent and moving procurement, I spoke. Scale up and fast in the hospital sector for ICUs, I spoke. Separating patients and staff. So that refers to when patients are suspected positive or COVID positive, they need to be isolated, and so do the staff that work with them, so that you don't have the same staff working with patients here and there all the time. And although that's difficult in a nursing home, many are doing it, and we will absolutely encourage and urge every nursing home to do that, because the alternative is worse. The alternative is really worse. Expanding ICU beds, we spoke. Attending to critical care and non-COVID-19 patients, we spoke. There is a report that is not public, but I get all kinds of things this day, that is called Critical Care Services Ontario report, where it says exactly the number of ventilators we have, how many of those are for COVID positive patients, how many for COVID suspect patients, and the COVID suspect for the most are really COVID positive, except that if they die during the time that they're COVID suspect, they're not counted as death. And that I want to talk for a minute. So the reporting of cases that you hear, as well as the reported of death numbers that you hear, are inaccurate. They are inaccurate not just in Ontario, in every single province, and likely in every single country. Because they only count, in Italy, for example, they only count COVID positive people that have died in a hospital. Done. So if you die of COVID positive at home, or if you die of COVID positive in an H home, as they care there, as they call it there, not even counted. And that's public, that's not invention of mine. In Ontario, you count as death any patient that was COVID positive. So to be COVID positive, basically, I'm preparing my tool. Heather is giving me a sign. Should I stop? Should I stop? I can stop.
2 minutes, Doris.
Who is going to take a picture?
2 minutes we got.
Okay, but then we need to put the whole enchilada there, and I take a picture of everybody. Okay? Or, yeah, Kyle, can you take a picture?
With Olivia, and I'm not sure if we can put everybody on video because we're on a very large group, but we can see what we can do.
It will be nice.
It would be nice, yeah.
Try, let's do. Yeah, we have 325 people to clap. Wow, let's do that. Let's practice.
Okay, she says we can't adjust the video for participants because we're in a webinar, not in a webcast, but she'll take the picture with those that are on the camera. How's that?
Just the 4 of us?
Well, yes.
Can we not put any more, at least a few more?
Well, maybe we could put Stephanie and Olivia.
No, let's put some members. Who are the members there?
Okay, she's doing what she can here.
Do what you
and
can,
somebody's saying
plain.
Yeah. It's just because of the format that we're in, but we've got 2 minutes, so we'll see what we can do before now and then.
Olivia,
Okay.
can you unmute some more people?
I can promote some people to panelists.
Yeah, promote them
And then I
quickly.
can just remove.
Promote,
Okay, so if you would like,
Janet Skiller.
Yeah. So I was going to say, if you would like to be promoted to a panelist, please let me know in the chat box and I'll
Ready?
follow along.
Go, go, go.
Yeah, and then you need to take yourself off of put your video on and your mute off if you've been promoted to a panelist.
Look what I'm going to do. I like more of this. Nice.
No, I like this. This is
Doris
perfect.
likes-
Oh, I like yours.
Yes, good. I'm here.
Okay, I like this. But where are the people?
They're all here with us. They're all
Where
doing
are
it.
the-
She's working as fast as she can.
Ah,
Yeah, they have to come on individually because we're in a different format because there's so many people, Doris,
oh,
on
I
the
see
call.
that already. That's good.
Yeah, there's so many on the call that.
You know, Doris,
Okay, it's
there's,
7:30. Shall we do it?
But wait,
Okay.
let's. Do we have a couple more?
I don't know.
Yes, we
Yeah.
need more.
Honestly, I can't hear them.
Betty,
Gonna be on camera in a minute.
Oh, we can hear you talking. That's good. So we know that we got people arriving. Excellent.
Oh,
Thanks, Olivia. This is a lot of work to get all these people on here, so this is good.
we're ready.
Okay, it's still 7:30.
All right.
Oh,
but I don't see them. Do you see them?
Yes, we can see them.
Ah, there
Okay.
is a lot of people.
Yeah,
Give us
there's
a
about-
countdown.
okay.
Okay.
Give us a countdown. 3, 2, 1.
3, 2, 1, go.
Here's all the healthcare workers. RNAO.
Thank you.
Thanking all of our wonderful frontline staff.
Nurses, doctors, healthcare workers, thank you.
For all you do.
Thank you.
At the same time.
Excellent.
Oh, Olivia, thanks for that heroic effort to get everybody on, as many people as we could, onto the panelists.
We are not going to demote them.
Amazing.
No, I didn't.
Together we can do it.
Together we can do it. Here we didn't say that.
Together we can do it.
Woohoo! Good job.
That's good. That's good.
And Doris, there are lots of clang written in the chat box,
That's
and lots
good.
of words of encouragement in the chat box.
That's good. That's good. That's
Can you guys share that video of us all clanging together?
Yes.
Amazing. We'll post it.
Fantastic.
We'll do that every Monday night at 7:30.
Every Monday, and
Yeah.
we will be prepared on the next one to. Good. I know it's hard, but it's good. Okay. So moving forward, so we spoke about massive public education, and we have done several pieces at RNAO. So use them; they're there for you. Okay, just use them. We have been constantly in the media. Again, Central Station. Next one, please. And that's the VNR's numbers, the most recent numbers. So that's fantastic. That is fantastic. Now it will be fantastic if not only they take the students, which they're taking in massive numbers, but actually that they take the critical care nurses, because that's the one that otherwise we will start to send somewhere else because they don't have that capacity.
In my room, if you want to grab
And Doris, I just want to let you know in the chat box, it's been very lively in terms of students.
So let's stop and ask, let's respond to questions, please.
Yeah,
or
so I just
comments.
wanted to say that students are very keen to volunteer. So we've sent the link in the chat box. Some are kind of ready to serve and kind of wondering if they're going to be called upon.
So no, let me correct. So
Yeah.
students, what you do is you actually need to go to our RNAO website. There is a list of homes listed there. You need to click the home, and then the home you will get a notice. So that's the way, and it's explained in my report. So look at my report, but also it's explained on the website.
Okay, great. Thanks.
Doris, is there any, I'm just sorry, Susan, I don't mean to interrupt, but there's other questions about students, and some of them are graduating in a few weeks. They want to know if they can continue their clinical placement so that they can graduate. They want to help, but they're kind of facing difficulties with that. Can you comment on that at all?
I will comment, and I'm going to get into deep waters with anyone that is faculty, but that wouldn't be the first time that we get in deep waters, because we differ very much on what has been done. And I would welcome if there is faculty from any university to comment after we comment on our position. This happened also during SARS. Students were removed from the workplace, even in the last semester, which to me and to RNAO is ununderstandable, to say the least. Number one, because these are students that are about to graduate in 3 weeks, 4 weeks, 2 months, and that have been preparing to serve patients. So I'm not saying put them with COVID positive patients, but put them in the hospitals or in nursing home or in home care somewhere. Number one, so they graduate. Number two, so they provide additional support to the workplace. Number three, because there is no better experience to develop leadership. I take myself as an example. I was in the 2nd year of nursing school, and they woke me up in the middle of the night. We lived in those days in a dormitory to open a unit for soldiers. It was not the most grave soldiers. It was mild with fractured soldiers. And I remember crying and saying, they must be confused, I'm a student. And they said, no, we can, they told us you can do it. And since then I became a you can do it person. So to me, it's a platform for professional and personal leadership like nothing else. And these students will never experience something like that. So to me, it's also a missed opportunity. I have raised it with the ministry. They are looking into it. Some faculty actually have called me to say what RNAO can do to push this forward, that they need to be back to the workplaces. Some universities have actually silenced students that wanted to push this forward. So there is a diverse opinion views. This has nothing to do with WSIB, by the way. WSIB, the government already told me, will cover them, so it's nothing to do with that. So it is unclear to me of why this is happening, and we are looking into that, Heather. So thank you for raising.
Did you want to hear from a professor, Oraziti from York University is on the webinar?
Sure.
Brenda Oraziti, are you available to speak?
So maybe when they're ready, or maybe they can send me an email, I will appreciate the emails. Let's do that. Okay?
Yeah, Doris, I just wanted to go back to ICU. I think it was an ICU nurse who said that they also need IV pumps to run sedation, paralytics, and vasopressors. So that's a need that they're not seeing identified.
So can you send me a WhatsApp after so I can look into that, please? Because that's not something, I mean, we have said ventilators and other equipment, but please do, because at least I can check then with the critical care table.
Okay, great.
Other questions?
Yes,
well,
there's some questions around masks. There are actually quite a few questions around masks to answer from before. Can we maybe go to the questions and answers section?
Yeah, totally.
So these are some of the questions that were submitted in advance of the webinar, and then there's some questions that align with these. So maybe about the masks. There are questions around community members wearing masks, questions around disposal of masks when staff leave the hospital, what's appropriate, and a question about re-sterilizing masks.
Yeah, all of the above have been in my report, so I will comment on that, but I would absolutely ask people to read the reports. Now, I know the reports are very long, and for that, either today or tomorrow, I'm going to launch a blog rather than the report. So it will be only 2-3 pages, and the rest will be links to other pieces on the issue of the community mask, the mask in public. So for a long time, Dr. Tam said, no, no, no. Some organizations moved to say yes, yes, yes. The first one, Michael Garron Hospital, that did something extremely smart, which is they asked people that were in self-isolation if they could volunteer with sewing machines that they had, if they could volunteer to do cloth masks. And actually they got already thousands of those. And the intent of Michael Garron Hospital, and is in their website, in the foundation of their website, even with the model, in case you guys want to promote that in your communities, was that was to protect vulnerable populations. East York, this community has a lot of vulnerable populations, and they wanted simply to give those masks to homeless people, to people that live in shelters, to elderly people, etc., as they go about in the street or in a shelter. And it is more to protect others than to protect themselves, because if the mask gets wet, or if you touch the mask in wrong ways, which let's talk about that after, the issue of doffing and donning is, and washing hands is as important as any mask, and we don't talk enough about that. But the issue was, that was why. But then there were those that started to connect the dots between what happened in some Asian countries and here, that in Asian countries, yes, it's true that China did a much more, well, a complete shutdown, complete. You needed to stay home, period. But in South Korea, they did not a complete shutdown at all. In Korea, what they did is massive testing. But in all of those countries, they wear masks. For those of us that have been there, we always are kind of puzzled why everybody's going with a mask. So it's to protect others as much as you. So finally, today, Dr. Tam said that yes, she is recommending for people to wear a mask. So the problem is, the main reason she was not saying that before probably is twofold. One, that there was not enough evidence that a cloth mask will do anything. And second, that she didn't want people to start to take these masks, right? And then we will have even less for health professionals. But the verdict is out, and now the answer is yes. The issue of the reprocessing of masks, I am writing about that tonight. I was thinking if I put it yesterday, I did a 2-page on that analysis of all that there is in the literature. And the issue with that is, first of all, 3M says no. There are 3 methodologies, and I'm not going to get into that, but there are 3 methodologies. And you need to protect not only that the mask continues to be good and all the filters, but you need to ensure that all the ties are not loose, because to have a mask that the filters are good but it's loose, then people start to fiddle with that, and then it's even worse. So what the hospitals are doing right now, those that are doing it, is they're collecting them. It's not that we're reusing them at this point. They're collecting them, same as the goggles and face shields. Those they are cleaning, but the others they're collecting, and they're doing in various places testing. And there is a whole table set up for this to decide if and when those will be used that are reprocessed. And that's where we from RNAO push, before you do that, open the doors to the not so best PPE N95, but to something that is better than the reprocessed ones, because we're quite concerned about that. In relationship to that question about antibody test, not at this point. Not at this point, and there are, as you know, also working on a vaccine, but that will take at least 12 to 18 months, best case scenario. And the issue of the mask is because of the transmission also now, that they know that the transmission, you know, it's more significant than what they thought, so that answers that. Is there a way to educate the public? Can you read that to me? I see the pictures in between and I cannot read.
Sure. This is a question about people who are in self-quarantine who have symptoms. And is there a way to educate the public to treat their own symptoms instead of them going to the ER if they're feeling ill?
Yeah. Well, the stay at home is the beginning of it, right? And I would say stay at home even if you have no symptoms of anything. Basically, the fact that we go out and we stand on those lineups, or to shoppers and there is a lineup, or to the bank or to whatever, and we touch all the surfaces of everything, you know, you may be with no symptoms today and then you will be back with symptoms a week later. So the stay at home, I think, is the real message here. And if, with symptoms for sure. Let me tell you that I know of people that already have died. I cannot share because I don't know if the person wants me to share. It's not in Canada. But I know, well, I actually know more than one. I know one of a colleague of ours that her niece died. I know the parisher, the wife of the parisher of my son-in-law in New York died too. I know of the godfather of my grandson that is ill, and touch wood, he will be okay. I spoke with him and he's feeling better. But this is serious stuff. This is serious stuff, and not only for older person. And people are just being fools if they think that this is, you know, not me, not me, not me, even if they are 20. There are cases of kids, even in Canada, I believe there is a case of a kid, a 5-year-old.
Mhm.
So this is a nasty, nasty, nasty virus that is invisible and is in surfaces, and it's not just, you know, aerosol, it's in surfaces. And just how do you go to a bank without touching things? And how many people just keep touching themselves? And if you put a mask, the doffing and donning for nurses and for others is critical, because if you start to touch here, that's it, right? You messed up the mask, or the mask messed up you, one way or another. So the doffing and donning, and that's why we have it on the website, is absolutely critical. And the washing of hands when people come back from the streets, right? On the handles and washing and all of that, it continues to be as critical, if not more than ever, because of the community spread. Then we have, what's the next one there? How to do e-counseling in COVID. Virtual. I think virtual, or by phone or Facebook or WhatsApp. There is a, by the way, a group, and I need to be reminded, so I put it on my, maybe Susan, you can Google it for us after. There is a group of 400 health professionals, so, psychologists, social workers, some nurses that do CBT and just counseling, that offer their services for free. So that's very good, and we should post it. And you know, it's not treatment necessarily, because treatment is a longer, you know, a journey. It is, even if it is just to vent, even if it is to talk about anxieties, like people should not feel afraid, especially frontline staff, to say that they are fearful, that they are scared. It's normal. Any of us would be. And they should not feel ashamed of that. They should just, you know, and people talk about these things and then they get on with the job. Sometimes they don't have even time to talk about that because of the pressures of work, right? But when they leave work and they go to their house and they're on the way to the house, back to their kids and families, you know, those thoughts go in. I remember those thoughts go on, and I hear that from nurses. Will I bring it to my family? How do I protect myself, right? And how do I protect the family? So those are normal feelings, and feelings that people need to, either they have someone good at home that can listen, as I happen to have, or they need someone else to listen to them, right? Because otherwise it stays in our body and just stresses us to no limit. I don't know. I see a colleague, I'm sure there are colleagues that are psychotherapists or in the team, but even every nurse will know how to, you know, if you have other ideas, please put that in your chat line. But I think doing that through technology is equally good. I was today seeing, the kids sent me a video of the two little ones of Aviva and Noah, Aviva and Eden, doing a dance class through the video with the teacher. The same teacher that they do Saturday and Sunday was doing for them all kinds of dance classes. It was beautiful. So, you know, the silver lining, we learn other methodologies. Create chat lines, create WhatsApp chat lines between you and your friends and you and your family, and exchange pictures, create chat lines with the other nurses in the unit to them. Like, all those are good things.
Doris, it's Heather. Can you just comment? And I know what your response is going to be, but we're coming up to some major holidays
Yes.
right now.
Oh, yes.
And I'm wondering if you could please, if you could include something in your daily update about.
I did.
Okay,
you
good.
haven't had time because I said
I haven't had time to read it.
I know, but you will see it in today. And you know why I did? Because nurses wrote to me.
Yeah.
So 2 nurses in 2 different workplaces that wrote to me that they were in the lounge, you know, when you get a break, and people were talking about their plans for Easter to go and be with the family. I can tell you, I am not in the front lines, and our 3 families are doing Passover separate. They have not entered this house. They don't allow us. They don't allow. They don't want us to go out the door. These kids, they're very overprotective with us. So they are each in their house, and we are going to do Passover together at the same time with the similar meal, as much as we can, similar meal. The gefilte fish will not go, but what can we do? I don't even have. But the rest, and we will do it together. You know, I mean, what can you do? Let me tell you, it's better than my poor niece in Israel, that his wife died of cancer, brain cancer, I shared with you, and that the funeral, that usually are huge funerals, was 10 people only, because that's the minimum you need in a Jewish funeral. And it was 2 meters apart from each other. That's tragedy. To do Passover or Easter in virtual, so what? The world will not fall if we are healthy, guys, right? So this is something I will continue to stress, and I'm so glad you're raising, and that those 2 colleagues raised it, because honestly, it had completely left my mind that there are 2 big holidays coming and people will do life as if life is the same as always, and it's not. The other piece connected with that, and I need to do more homework, so guys remind me, is that I hear that some doctors, I don't know if they got from government or if hotels offered to them or what's the story, hotel rooms that they can stay after the shift. And I also heard Betty from our board said that she is in, you know, Heather, our VPSO. The VPSO that you went to visit with them. Betty, our board member.
Betsy,
No, Betty, not Betsy, Betty.
Oh, in Chatham Kent Health Alliance.
Yes, thank you. So Chatham Kent, actually hotel, said, we are here, we offer you rooms for free to doctors and nurses to stay after the shift for the period that they need to stay. If we could get lots of more hotels, and maybe we can do that, Heather, by calling hotels, putting a couple of people.
I think we've got a few key contacts we could absolutely
right, the same hotels, Heather, that serve us during events, that we pay a lot of money, because I think it will be magnificent, right? Even the ones in Niagara that we use, because
you know what, I've got 3 or 4 teams that I can, or 3 or 4 people that I can put on that.
Fantastic, because imagine if they could reserve, you know, each one of them 20 rooms or 50 rooms for nurses, so we can promote that. You can put nurses and members of RNAO.
Actually, someone's also asked a question about RV facilities, and I know some organizations have donated their recreational vehicles to nurses so they can stay there but still see their families from a distance.
That's beautiful. That's beautiful.
Mhm.
But let's do a campaign of getting all those
Yeah,
hotels that we have used in the last 3 years. Anyways, they're not doing business.
No.
So no, could be very good. Could be a huge promo for them too. Tell them we will promo them.
Yep.
Fantastic.
Yep.
Doris,
If
I
any,
did see these other questions, and I gave them to Susan because they came from a call. One was the issue of healthcare organizations hoarding masks, and the other was an organization that had all kinds of equipment from Ebola to be Ebola ready, and they have not seemed to have brought that out at all. And that, of course, includes the major gowns like they're using in Europe.
yeah, thank you for raising that. If you could send me a private email, meaning not private, an email to me,
Yeah,
so
I
we
will.
can have more conversation, because I know that one of the first things that we at RNAO pushed, and actually it ended up being a press release that we did jointly with OMA after, was the issue of getting the equipment from absolutely all the schools. So the labs of simulation from nurses, from doctors, from RTs, etc., etc., and then also all the equipment from dentists and aesthetics and all of those surgeries, right? Botox, Schmotox, that they have all kinds of equipment, and the nails piece also. So they have brought lots of that equipment into the hospitals, right? Now, Heather, can you tell us what happened with other collection?
Yeah, we've had a small amount of equipment that's been donated to long-term care homes. Some of the schools of nursing that had not already previously donated went to long-term care homes. We had some small amounts that were either within households or within private practices that were closed, went to long-term care homes. But I will just say that the schools of nursing were extremely proactive in making sure that they donated everything from beds, ventilators, PPE, like everything in their labs. Their sim labs went to where it needed to be very, very quickly. So just want to congratulate them for that.
Fantastic. That's fantastic. So York University School of Nursing donated to Mackenzie Health. Fantastic. Beautiful. Yeah, excellent. Not donated, huh? The beds will not be donated.
Give it
They will
away.
go back. Yeah, but I understand. That's fantastic.
Yeah.
And we are nursing, we are chemo gowns for chemo disconnects. I don't see that.
The other issue, though, Doris, about the hoarding is some nurses feel that administration is keeping back too many masks, and they feel they're working at risk.
Yeah, so the issue is this, and that is true, is called rationing. So there are two ways of rationing when you don't have enough, right? If you don't have enough, you don't have enough. One is the organizations that are saying we're going to recycle or re-sterilize the 95s. The other is what they're doing in places like Quebec, which is they give you 5 and 95. And that's your stock, because we know the virus lives max 4 days on surfaces. So you use one, then you use the other, and you leave them and you rotate them, right? I'm not, you know, you need to be an expert on material analysis for that, not just epidemiology and infection control. To me, intuitively, that looks better to me than this thing of re-sterilizing. But I am sure that those that are doing the analysis will decide what they do. I don't know if we even have 5 and 95 per nurse in ICU in Ontario. In Ontario. Yes. Okay. What's next?
Doris, there's a question here that I don't think I've seen in your updates, and it's how to approach families of those in nursing homes if the advance directive is aggressive to send them to the hospital, and the hospitals are feeling the surge and are functioning over capacity. What can we do?
A person that is not COVID positive, she means, or he means?
There actually, if someone can write in the chat box the clarification of that.
I assume that
COVID positive.
I assume that you are not saying COVID positive. If a person in a nursing home, so there is now a clinical.
Yes, not positive, not positive.
It's not exactly, because for COVID positive, there is a very clear guideline. Not necessarily that I agree, but there is a very clear guideline of what to do, and I can talk about that. It's not public, but I can talk about that. In relationship to not COVID patient, if it's a situation that it requires a hospital, depending on, I would try not to send anybody today to a hospital, number one.
Mm-hmm.
I keep saying to Ricardo, please hold into the stairs handrail, because we are not going to a hospital. And we are not all the road. You know what I mean? We are pretty stable on our feet. I just want to make sure that we don't touch a hospital. Even if they had space for us, I wouldn't go. I mean, seriously, it's not a good situation, a hospital today. But it depends what's the situation, right? I mean, if it's a situation that could be cared for at the home, I would say bring an NP rather than send the person to a hospital. Now, some situations you cannot avoid, and you need to send the person to the hospital, and that needs to be looked and discussed of why and what, right? So I think it depends on what's the situation. But I don't think that hospitals are stopping from people with any kind of illness. I mean, people continue to have all kinds of things. People have heart attacks, people have strokes, people have falls, people have everything, right? Life didn't stop because of COVID-19. Maybe less falls because people are less out and about, unless they get drunk at home and then they fall through the stairs, which I hope it's not happening too much, right? No kidding. Think about addictions. Think about addictions. If you don't think that in a situation like this, addictions will go up, and death as a result of addictions and overdoses and over drinking and etc. because of the stress, we are kidding ourselves, right? That was the main reason why the liquor stores were kept open, not because they buy a beer, but because of withdrawal, right? So in any case, in relationship to COVID positive and the guideline that I was talking about. So the guideline doesn't speak about old, young, or whatever, but the guideline is a technical guideline of the potential chance to survive after using a ventilator, right? And depending on what are your comorbidities and what is your overall state of health, is your overall capacity with the help of a ventilator to make it or not. And people that are in nursing homes in their 90s, you know, usually have many comorbidities, most of them, not all, right? And so the issue is, you don't talk about the resident about you will not get a ventilator, but you talk, and that's why I like so much that video from Michael Guerin. You talk about what does it mean to be in a ventilator, because it's not a picnic. It's not easy at all. It's very uncomfortable, right? And if the chances to survive are 5 to 10%, you know, how many people will say, yes, take me, right? I will be the first one to say, no, thank you, even without COVID, right? So, you know, at age 90, I will say, I had a great life, thank you. Don't give me a ventilator, thank you very much. And with COVID, even less, right? The issue then becomes, to have the conversation in time, and we had this great conversation with NPs at the NP discussion today, NPs in long-term care with 35 of them. To have these conversations with the resident, with the family, to see what's their choice, right? And if their choice is which will be likely 95% of them will say thank you, no, then to have a plan for palliative care. So the resident, it's not a pleasant death in COVID, just so you know. It's not a pleasant death because, remember, it's about the lungs, right? And it's about fluids and it's about secretions. But if you have a good plan of palliative care, that can be diminished so much so, right? And people can at least die in peace, which brings me to the point that my absolute beloved and dear friend Shirley Douglas passed away yesterday. Not of COVID, not of COVID, but yes, of complications of pneumonia. But again, Shirley wanted to die already 5 years ago. 5 years ago. In fact, so much so that I said to her that she should be talking with, you know, someone that speaks about these issues of dying with dignity and, you know, assisted dying, etc., which she did. Well, I don't know if she did at the end or not, but she died in peace. What a woman! What a woman! Amazing, amazing, amazing lady. I will miss the Thai dinners at her house. Yeah. Okay, but she will stay with us forever. Just an amazing lady. Okay. That was good to get it out of my chest. Okay, what's another question?
Well, on this screen here, Doris, there's one just about our stance on the use of treatments or prophylactic protocols that we're seeing in the media and malaria medications. Do you have a stance on that?
Yeah. So it's not my stance, it's the stance of science at this point. So this started with a treatment that was given, and then President Trump was asked to comment, and he basically said, feels good to me. I think it's a good idea. And the poor person from CDC was going berserk behind him, all nervous, and his face was dropping. And yet President Trump was saying, I think it's a good idea. Why not? And what happened is that 2 days after, a person died, right? The person self-medicated with the drug it's a combination of 2 drugs, and you can send them the press release that we wrote, RNAO, OMA, and the pharmacists. We wrote a press release on that, and it's on our website also, but you can send it, Kyle. So that not only a person died, but there is no proof to it yet. However, it's being tested in several hospitals in the US and some in Canada. So the verdict is still there. The problem is if people start to self-medicate now, they can do more damage than good, because even if it at the end is effective, may not be effective depending on your comorbidities, right? And may not kill you from COVID, but you will die from something else by taking the medication. That's why testing is so important. And second, if we start now to trial life when it's no, medications take time for a reason. First you do animals, then you do humans, then you do control trials. It's not a simple thing. I think it's a good idea. We will leave people with arthritis and with the need of that specific antibiotic depleted from the drug. So at this point, the answer is no, until there is proof that the science is recommending. And even then, it will be with prescription, not just self-premedication, medicating oneself.
Okay, I think you answered pretty well most of the questions here on the screen, Doris. I just wondered if you wanted to say anything more about airborne transmission. Is there anything in terms of aerosolized transmission versus just droplet transmission?
You know what? It will be in my report tonight. That is with the issue of the PPE. So why don't we leave it there, and it will be in writing and it will be solid and okay?
Sure, that sounds good. I just wanted to bring something to your attention that I hadn't considered. It's about limiting construction workers, but that's a social determinant of health consideration in terms of housing construction, and we have such a low number of affordable housing here.
So I can assure you that the construction that was kept open is not the supportive housing construction. It's the big, beautiful houses, hotels, whatever.
People can pay for.
Exactly. I would be with you if it was about supportive housing only. I doubt that that's the case, but we can look at the guidelines. I may be wrong, but I did post it in my report, exactly what they sent to us. So tell me if I'm wrong, because I didn't read in details.
Okay, that sounds good. And also, just someone pointed out women's shelters. You've talked a bit about shelters, but someone is pointing out specifically women's shelters.
So all the shelters, what is being done across the province, and specifically in Toronto, and Mayor Doris sent me a beautiful letter yesterday in relationship to what I'm pushing on the 4 sites for Dr. Andrew Bond and Lee and their team to really get moving with that, which is for COVID positive patients. But they're doing quite a bit in relationship to shelters and moving people into hotel rooms, motel rooms, etc. More than certainly what you see in the US or other, some other countries. I mean, I don't know if you have seen the piece in the US in National 2 days ago, was absolutely out. It was devastating, devastating. Was this woman with all these bags going in the street, absolutely full of bags. And she was with a reporter, and she said, for the first time in my life, and I have been a homeless woman for many, many years, for the first time, I truly have nowhere to go. And she said, I mean, nowhere to go, literally. I cannot even go to a bathroom in a coffee shop to do my needs. I need to do them in the street. I have nowhere to go at night back. I have nowhere not just to shower, but to do my basic necessities. It was devastating. Like, picture that, right? It reminds me when I went to India with Premier McGuinty, and I went to the Red District by mistake, because I don't regret that I went, but the images are in my head, right? Of kids doing their necessities in the street, people, adults, you know what I mean? This is a rich country, the US. This is a rich country. How come they don't leave something open for these people, a few places open to go and shower or do their necessities? It's just inhumane. What's happening there is a disaster of major proportions. It will be written in history books. The whole thing will be written in history books, but the US chapter will be a special chapter, just because of the richness of the country and the terrible situation that has been mishandled from head, first of all, with politics at every step of the way, rather than looking at the people that are, piling up in common morgues outside of hospitals. Like, picture, how is that, right? In a rich country that has the means to do better. And picture the nurses and the doctors and others, that the people that need to move those bodies, that need to work under those conditions. Is to dream for that for every single night thereafter. It's just unimaginable, unimaginable. I honestly never thought. I knew the US. I lived there for 6 years. My kids lived there for way more than that. My son-in-law is from there. I knew their health system is faulty, hence why we came to Canada. I never in my life, never, if someone would have told me that New York will be the way New York is, and Washington, and then South Carolina, and many others now, I would not have imagined. I would have said, this is a bad book. This is a, Hitchcock book. It cannot be true. And it's true. So yes, we always could do better here, but the reality is we're doing significantly better than many others that I know. So our approach always is, let's thank and celebrate what we have done, and then let's push and ask for more.
Thank you, Doris. I'm just following up on what we were talking about prior about the housing, and it's Diane is confirming that it's residential housing, building residential housing. So that is her concern.
Yeah, I'm not surprised. I'm not surprised, right?
Doris,
I'm sad, Susan, but predictable. Yes.
Doris, there's a question about home care, and I wonder if we could address that because we haven't heard from that sector.
So we have not only we have, I have spoken in the media quite a bit because home care is missing this completely. All the big chains and the small chains, to the point that I connected them with with importers that the government has not taken, and they have taken upon themselves to order by themselves. Because what happens, imagine, and maybe I have not written about this and I need in the blog, is that it's not only that the nurse or the PSW or, needs to go so that protects the patient from what you are bringing from outside, right? This is the point here. And you're going from home to home. Like you're going to all kinds of home of very sick people with cancer, with wounds, etc., right? And you're going as if, so not only that, people in the homes now are not letting nurses in. And you would do the same, imagine, knowing you, and I would do the same.
Oh,
if I was sick, I would say, thank you very much. No, I don't want you to come, right? So this is what's happening, and this is why we are now calling for universal masking. Absolutely universal masking.
Exactly, yeah.
Thank you for reminding me, though. That's perfect.
Okay, good. So Rose, stay tuned. You'll be hearing more then from Doris.
And from all of us. And if there are new issues that you guys need answered, maybe they can send them to you, Susan, or to Olivia. What do you think?
Yes, and I think we're addressing a lot of the questions through the discussion today, but there are still some we have to sift through the chat box a little bit and maybe summarize for you for your updates, any kind of new issues that we can't answer. So then you can bring them forth to future updates.
Every Monday, 6:45, right?
Yeah.
Do we do good with the time? Should we say, oh, we don't do any good?
We're not.
No, we don't, but it's
So maybe we need to post it as such, Susan. Like we should say 6:45 to 8:15 or to 8 at least.
maybe 8.
Yeah.
Knowing we take a break at 7:30 for 2 or 3
Very
minutes.
good. And next time we all bring coffee and maybe some pastry or something yummy.
Or a carrot stick.
I don't have any. I don't have any. I put an order. You know, guys, you can all order. Huh? So I put an order, and I wanted carrots. I said, enough of eating junk and chocolates. All the chocolates I had left from the holidays, I'm eating chocolates. So I wanted carrots. They didn't have carrots. Carrots are gone. It's like toilet paper, gone.
I just wanted to confirm that, yes, we are having a webinar next Monday. Someone was asking about it being Easter Monday, but we are still scheduling one. I also want to point people's attention to the webinar that we have on legal issues in nursing. That's on the screen there, and you can register for that on our web page. And the Facebook groups that Heather mentioned, just stay tuned and you'll see links to those and Doris's updates when the 2 new ones are available. And we will post this recording on our website. We'll archive this and then bring forth any sort of outstanding issues to Doris. Heather, was there anything else that you felt like you wanted to bring forth?
No, I think you summarized nicely, and anything that didn't get answered tonight, we'll make sure it either gets in the update or we bring it forward on the agenda for next.
And talking about the agenda, watch the agenda of Steve Bacon this Wednesday. because you will see us there alongside with the president of the OMA and an ethicist from U of T. And I understand the topic will be the duty to care, and I'm going to be talking about the duty to protect. The two, it's a two-side deal, not just a one-side deal.
Great. And that was Wednesday, you said, Doris?
This Wednesday, the agenda, Steve Bacon. Yeah. Excellent. Thank you, everybody.
Okay,
Keep up,
great. Lots of thanks in the chat box. Doris.
keep up the good work,
Thank you, Doris.
everybody.
Bye, everybody. Have a good
Bye,
evening.
bye, bye.
Bye.